you know people that it would make it easier in the evening, please be sure to let them know about this. Just to note that the restrooms are off to the corner over that direction. There's a glass door with a wood trim, and go down that hallway. Otherwise, I think we've covered the necessary housekeeping things, so let's get started, okay? So today I want to talk to you about Metro-wide resources. I've even got a good friend of mine, Lynn Ammon from Family Means, who's going to talk to you today as well. She's got resources in the back for you. If you look at the next slide, I've given you the 7-county metro area that most all of these are from. However, I have covered some resources that are outstate. In case you have family that lives out of the metro area, it might help them get started on getting connected with something. But what I want to do is review a couple of things to make sure I express the importance of them. So we'll go to the next slide after this. Lynn, would you be able to come up here with me for a second? So the one is that I want to talk about the hand under hand position. Lynn, have you done this before? I have not. So what we did last time was we demonstrated it, but it didn't get filmed, so I want to be able to have people from the community see this as well. So if you were to greet someone with dementia, this particularly works well with people in the later middle or the late stage. You would come at them from the side so that they can get away from you if they wish. If you block them in, you're going to cause them to be upset with you most of the time. So if you come at them from the side and you offer your hand, do you see how we're in a handshake right now? If you then move your hand around their thumb, now what I can do is take a spoon and help her to eat, but she has the sense that she's doing it herself. I also could zip a zipper, and she feels like she's helping with dressing, so there's less pushback. And you can help with washing. You can get a washcloth in this hand and help with washing under the arms in private areas, so that can be very helpful. So I wanted to make sure, thank you, Lynn. I wanted to make sure you saw that technique, and there's a link on there that you can watch Teepa Snow demonstrate this. And because I do think this is a technique that if people knew about it, it could be very, very helpful in their trying to do cares at home. But also helping with cares if you're, for example, me, when I visited my mom, I was the primary caregiver, so if I was helping her get ready for bed in the evening, sometimes this was a technique that could have helped me. The next I want to remind you on is the hearing test. If I have not told you often enough, I want to make sure you hear it clearly. Make sure you get your hearing tested annually. Hearing struggles actually impact your brain. So if we want our brain to last our lifespan, we want to make sure and stay on top of our hearing loss and use whatever we can to help our brain get that information that's coming in from our environment. The same goes for vision, to get your vision tested annually. Have you ever visited somebody whose glasses are just terribly dirty? Yeah, so sometimes just by saying, hey, you know what? My glasses get that way sometimes. Would it be okay if I washed your glasses up in the restroom? Because it can really change the perception of what they're bringing in. And I'm a believer that regardless of where you're at in your dementia journey, I want as much information going to their brain so they can live life with quality of life, okay? So that goes for everybody. On the flip side, I will also tell you there may come a time in someone's journey, if they're far along and it's too stressful to take them out for testing, that I wouldn't continue the testing. But do you follow what I'm saying? If they are tolerating going out and you can, or if you can have them tested at the facility, if anyone comes in to do that, take advantage of it. All right, let's jump into our Metro resources. So I want to go to the next slide. And first of all, let's think through who could be resources for you in your journey. And that is, are there family members that can help, or friends or neighbors? Is there a faith community nurse or pastoral care? Are there volunteers? Thinking befrienders, for example, are Stephen ministers or care ministers from your faith community? Are there social work professionals, which is what Lynn is, that you'll get the chance to hear from her today? There are people called geriatric care managers, and they can help assess needs, coordinate care, provide guidance, and monitor progress. So for example, in my situation with my 4 older brothers, my mom lived in southern Minnesota near all of them for most of her life. The last 7 years of her, no, that's not accurate. It was probably the last 4 years or so, 3 years of her life, she moved up to the Metro to be with me. And so I was able to coordinate more care where she lived at a skilled nursing facility. But had I not been able to be close, it's possible without family or people that felt they could do that well, that I might have hired a geriatric care manager to help me. Healthcare providers, sometimes your primary care provider can be a really good resource, but I find that insurance limits them to how long they can spend with you. And therefore, sometimes it's worth going into a memory-specific clinic at a neurology clinic and having time with a neuropsychologist, a psychiatrist, a neurologist, and possibly even on staff as their social worker. Yes?
Where do you find geriatric care managers?
Yeah, so Lynn may also be able to help with this answer, but I want you to think about, I will often Google to see, are there geriatric care managers in St. Paul, in Woodbury, in Shoreview?
Oftentimes they're connected to a clinic and they're called a care coordinator.
So they're oftentimes connected with a clinic that you go to, and they're called a care coordinator. So be thinking about those options. And the next is mental health professionals. So I list these because there are some people who are aware of their decline with their dementia, and it's very stressful for them. So I'm thinking in the early mid stages, is it possible that by utilizing the back of your insurance card and calling your insurance, you can find places within your insurance system that will help for that person to go process with a psychologist or a counselor? So don't let that go as a possibility. The other is, as a caregiver, I utilized my psychologist for a very long time because I was caregiving for a lot of people at the same time. 3 parents and a child. So mental health professionals need to be part of your resource. The next that I want you to think about is the associations and the national nonprofits that might be available kind of as a starting point. So for example, I've given you the link for the Alzheimer's Association, the Lewy Body Association, the Frontal Temporal Degeneration Organization, and the Vascular Dementia American Stroke Association. Keep in mind that the Alzheimer's Association is kind of the clearinghouse for all dementias, but with my father-in-law, his Lewy body dementia was strong in the fact that he had hallucinations. However, they did not impede on him being able to be still an organist at his church, right up till a couple months before he died. Okay, so it was trying to understand that and working with the Lewy Body Association, but I'm also going to give you some other Lewy body resources that are specific to this area, okay? We'll go on to the next slide. And there's other local, state, government, and tribal social services. So I want you to think about the Elder Care Locator, which is a public service, as well as the Indian Health Service, if that applies. Then I want to break down on the next slide the types of respite so that you actually can see the varying ways you can use respite. So there's in-home, where you can pay, for example, An agency or a home care agency is another place that you might have someone, or a volunteer might come into the home to help for a short period. With home care, you might think of it as companion care. That's often the least expensive of people that can come in. They're not going to toilet the person. They're not going to do bathing like a nurse's aide. The next would be if they have a volunteer or companion at a social service agency. Some, through grants or such, are able to have a volunteer come in without cost. The next is a group respite, which is what I worked with for, 15 years. And that is that temporary relief where you take them somewhere, have your person living with dementia stay for a 4-hour time period while you're able to go and do things like doctor's appointments, hair appointments, lunch with a friend, go home and take a nap, which is definitely what we saw people do. But now, with all these respites, you're looking for the opportunity for socialization. That's important for brain stimulation. You're also getting activities like reminiscing, music, exercise, art expression. Some are licensed adult day where they can provide personal cares. Now, your next respite is at a facility, and it can be available at some assisted living or long-term care facilities for stays of a few weeks. I've not known of any that will take them for just a few days. They usually limit it to a few weeks, and it might be, for example, when a caregiver has surgery or wants to go visit family someplace warm in the winter for a few weeks, or there's been a health change for the caregiver. So be thinking about those respite options that are available. The next thing I want us to think about is the levels of care. So if you're just looking for day-to-day support, some people might start out with 1 day of support a week, and then as time goes on, they might take a respite for a few days a week. But they might also need somebody to come in with supervision. For example, to deliver meals to the home, to do transportation, maybe to set up medications. Then there's residential care, which would be your assisted livings. Now, from my own experience, unless something has changed at the assisted livings that I don't know of, but my parents, both of them, lived in assisted living. My mom was able to live with my dad for 10 years in assisted living because he was in the room with her as well. Once he passed, she would not have been able to stay at that assisted living because as her needs got more and more, she was falling more. If there would have been wandering, it would not have been safe in an assisted living. On the opposite side is if they're in a memory care unit at an assisted living, that can be appropriate. And some, I don't hear of it very often, but I have had some caregivers who've worked it out with the memory care that they've stayed in the same room as their person. So they could be together. Also, I want you to think of nursing homes or long-term care facilities. That is what my mom transitioned to because her needs with her Parkinsonism and her Lewy body, her mobility, her falling, she needed a lot more skilled care. There's also places that are continuum of care retirement communities. So they might start with a townhome, then go to an apartment in the independent living side, then move to assisted living, then if they need it, they move to skilled care. Okay, so now let's think long-term care in the home, because some people can afford to do that. Or some people have a benefit, whether it's through the VA or something where it is able to be an option for them. Is it possible that there's unpaid family and friends that are willing to be a part of that team? Then what about paid services for general care, medical care, and then things that would require a doctor's order and involve a licensed professional, like your nurse to set up medications, a nurse to do wound cares, a nurse to be checking on the diabetes, to be doing blood pressure checks, to be drawing labs, So there are definitely many different options to be thinking about. And when you know one person with dementia, you know one person. Therefore, you need these options to decide what's the right fit. I don't want people to forget hospice. Hospice is incredibly valuable, not only for the person living with dementia, but also for the family for support during that time. So although my mother was living in a long-term care facility, we had hospice come in to provide care for her the last 10 days of her life. And they were so helpful for the staff at the facility as well as for us. All right, let's just talk a second about home care agencies on the next slide. So what I want you to know is that these are caregiver professionals. So you're considered a caregiver. These are considered caregiver professionals. If you're wondering about home care, if you go to a support group, I encourage you to talk to other members in that support group if they've had experiences with home care agencies. I have not referred to home care agencies probably in the last 2 years, and therefore I don't feel that I'm quite up on what I'm hearing from caregivers. So I would refer you to someone like Lynn's agency to get more current recommendations. But with help, for some people, living at home can be safe and familiar and flexible. It is, however, can be a more expensive option, and if it's used for a long time. But if you take and compare those dollars to what it costs to live in an assisted living for a month, depending on how much care you need, sometimes it's not more expensive. And a home care agency, like I said, can provide companionship, personal care, skilled medical support, and other services that are tailored to that individual person's needs. One thing I didn't talk about in the notes today was, although you're going to get a workshop that's coming up, and you need to know about it because there are tools available. For example, if your person is safe living at home and just having someone check on them daily or however is felt that it is necessary, there are machines that can be loaded with medications and alarm and push out that medication for that specific moment that it's needed. Now that works for somebody who's in their home all the time. If the person is out taking walks and going out and about a lot, that'll be harder because they may miss a timed medication, unless they're only taking medications once a day. So just some things to think about there. The next one I wanted to talk about just a little more in detail is the hospice agency. And that is that some people with dementia that are in hospice care, unless something has changed, it has been that people with dementia can be in hospice care longer than other people. I have known people who've been in hospice, been discharged because their health has improved, been put back on hospice, been discharged, and then been put back on. So there are, working with your medical team, that is possible, but it is so helpful during those final stages of dementia. They will focus on comfort and dignity, pain management, emotional and spiritual support, respite care for caregivers, and grief support for the families. So it's really lifting up peace and respect in those final days. They often have a very holistic approach, prioritizing quality of life and the emotional well-being of both the patient and the family. So I just want us to be remembering hospice. The next resource I want to share, do you feel like I'm giving you an awful lot of information today? I hope not. I hope you won't be overwhelmed, because what I really just want is for you to see you've got more than one option here. I'm giving you lots of things. If your person is a veteran, have you thought about finding out if they have benefits? Take advantage if they have benefits, okay? If you call your county veteran service officers, they can specifically work with your person. These are dedicated professionals, and there's at least one in every Minnesota county. They will assist veterans, their families, and survivors in accessing benefits and services, and they'll help you in applying for them. And I've also given you other veteran phone numbers and links there because I want to make sure that people utilize their veteran benefits. Okay, the next one is for diverse adults. So it's possible that the National Asian Pacific Center on Aging could be of help, or the Caucasus Center on Black Aging, the National Hispanic Council on Aging, the National Indian Council on Aging, or SAGE, Advocacy and Services for LGBTQ+ elders, as well as Southeast Asia Resources Action Center could be of help. So if you're seeing that these aren't helpful for you, that's just fine. I'm imagining as we have a lot of people that are seeing these on the link that I provide you at the end of every presentation, that somebody's gonna think, oh, I never thought about contacting them, okay? The next one is clues. I don't know if you've heard of clues, but I see some heads nodding because you have a large Latino faith community here. And clues is Comunidades Latinas Unidas en Servicio. And so this is for those Hispanic people. And I've given you the 4 areas across the state, the number for St. Paul, Minneapolis, Austin, and Wilmer. So to make sure that people can get, you want to make sure that they have somebody that speaks their language so that they're getting and comprehending the information that they need and want. I think I brought this up in past presentations, but the next one is to make sure you know about elder law attorneys, because they will help navigate the legal complexities of aging, securing finances, and safeguarding well-being. They are specialized in the legal field to address unique legal, financial, and personal needs of older adults and their families. It also encompasses a broad range of issues, such as planning on the future, protecting assets, ensuring quality of life, legal, financial, healthcare, social services, estate planning, asset preservation, healthcare and long-term planning, guardianship and incapacity planning, protecting against elder abuse and exploitation, veterans benefits, and special needs trusts. I have referred many caregivers to elder law attorneys. Okay, this one, I want you to know that there are some resources available that could give you some assistance in paying for, or some ideas in paying for care. I want you to know for support groups, most often they're free, but they might ask for a donation to help cover their professional that they have facilitating the group. So some will ask for a donation, but now you can also go to the support group and talk to the caregivers of how have they found resources that have been of help. So I'm going to give you one that I'll talk about a little later in the day. But at one time, Dakota County's respite services were free. I don't know if they still are. So again, talking to other caregivers, you're going to find out things that you might not have known. Then I've given you the contact for the Centers for Medicare and Medicaid. There's a benefits checkup, a free service from the National Council on Aging, and the benefits.gov. And I added long-term care insurance because for those that, so I'll give you my own personal example. I was caregiving for all 4 of our parents by the time I was 32. And because of the strong health issues in our family, high risk for stroke and Parkinson's, my husband's Parkinson's and cancer, we both felt that we were headed for potential health things in our aging years. So we went out and got long-term care insurance when I was 32. So just to be thinking about. And part of the reason I'm bringing this up is you may feel that's not an option for you, but is it something you want to mention to your children? It's much cheaper the earlier you buy it, okay? All right, we're moving along really good on time, which I'm glad, because that'll save time for questions as we need them. So the next thing I want to talk about now is I'm going to get into, I think, about 24 or 25 different agencies that I want you to know about. Have any of you heard of the Metropolitan Area Agency on Aging? It used to be called MAAA. They're now called Trellis. And so this is for the 7-county metro area. And so I've given you their the link to get right to the Trellis website, as well as a phone number to reach them. They will give you caregiver information and assistance, and they have information specialists and can help you also across the state, and I'll give you those contacts as we go through this today. Know that their website is being updated. I will tell you that although this is a broad resource, this is not the one I would use first. I would go directly to an agency in my community. But I want you to know about them, okay? Also, I want you to know about Trellis's, the next slide. I want you to know about what's called their care ecosystem, and I've given you the link to that. It's a free phone-based program to help people living with dementia and their caregivers to navigate care and support. And there's local care team navigators in partnership with a licensed social worker. So I want you to know about the care ecosystem. Now, if you go to the next slide, what you'll see is I've laid out a map for you of the 7-county metro area so that we can be very clear what areas we're talking about. And as we get to each agency, I'm going to put little yellow stars on those maps so you can kind of see where these agencies are located at, okay? The next slide is going to show us outstate now. And the Minnesota Area Agencies on Aging is located in Duluth, St. Cloud, Warren, Minnesota Indian AAA, Mankato, and Rochester. Because my parents lived outstate, you might find that this will be helpful for you to know. The next resource that's available is Juniper Health Promotion Classes. And so I've given you the link as well as the phone number. You can also email them, and if I didn't say it, I meant to say it earlier, that Trellis and Juniper are going through a big website redo, and they're saying by April it'll be live again. But know that if you have trouble finding some classes because agencies are in between classes, you can go to Juniper, or you can send them an email saying, for example, I'm looking for a Powerful Tools for Caregivers class. Do you know when the next one is coming up? So that is why I've given you this resource. Okay, on the next slide, we're going to go to another resource, and this one is an online platform called TrueAlta, and it's to help families build skills to manage care at home. So it's free for you. The lessons range from 5 minutes to 2 hours. But of course, you can shut it off when you get distracted and need to do something else. And it's, I want you to know that in order to get into the TrueAlta site, you need to request a registration through one of the agencies that I'll be listing coming up here, okay? So, what we are going to talk about first for number 4 is family means. And I have Lynn here today. She has her master's in social work. You can see what they provide, but she's going to get up and talk to you. And what I want you to know that if you look at the next page for the map, can you see those 3 yellow stars? So they're in Stillwater in Washington County. They're in Hudson, Wisconsin, but they're also downtown St. Paul, okay? So Lynn, if you want to come up and go ahead and go to the next slide.
Carolyn. Hello, can you hear me okay here? All right. Wonderful. Great to be with you all today. I'm just going to do a brief introduction of who I am and how I actually am connected to St. Odelia's and have a personal space and place for this community. And share with you a lot about Family Means in our time together. As Carolyn mentioned, I have been a social worker for 35 years. I did the math this morning. That's a number that I don't keep track of, but because this is work that I am so passionate about, I've only served all my work as a social worker has been working and supporting families in community so that you can stay connected. And so within that space, I have walked not only professionally but personally along many families living with dementia. The last time that I was at this on this altar was when I gave the eulogy for my mom, my own mom, who had experienced a 10-year journey walking with dementia. And so I personally know how the impact, ins and outs of those spaces and places. So it's wonderful that you have an opportunity to learn through this series, to spend time with one another, and to gain that sense of connection to what do I see that will support me in many times what is a day-by-day journey, a moment-by-moment journey. So I work for Family Means, and Family Means, like we see on the map or saw on the map, is an organization that is housed out of Washington County. We are right off of Highway 36, but you'll see as I go through our different ways that we have touch points with families out in community, a lot of the work we do is throughout the whole Twin Cities, mostly within the Washington County boundaries, but because we serve a lot of individuals virtually, we're accessible. So we aim to work with families, and if you call us and we're not the right fit, our goal is to get you connected to wherever the right fit is. Our mission at Family Means, if we want to move on, I am part of the Caregiver and Aging program at Family Means. We are part of a larger organization with many other services that I'll talk about at the end of our time together. Our mission at Family Means is to strengthen communities by helping individuals and families through challenges in all stages of life. And you see the little asterisk there next to families. We define families, as many of you are family caregivers, as however, whether you're living together, apart, related by blood or not, marriage, adoption, or just the commitment to care about another person. That is how we define what family means to you. Our vision at Family Means is to have a vibrant and resilient community where everyone lives to their fullest potential. We can go on to the next slide. This is a little bit of a visual of the team that I get to work with on a daily basis. And I know that Carolyn's been talking wonderfully. I'm so glad to see that she has really filled you up with a take-home packet that covers all the different ways that you can be supported, because for a caregiver, you never know when you're going to need it, and you can just pull it out. My hope with my time with you is to go a little deeper with who's the faces behind the people that you might be in need of connecting with. And so here we are. We're a mighty team. We are made up of Beth Wiggins. She is our lead social worker as the director. I am a social worker along with another social worker on the team, Bree. We have a volunteer and respite coordinator on the staff. We have a community engagement and intake staff person. We have a dementia program coordinator who is an OT by trade. And then Jenny West is our community educator. And so we bring to life everything that we offer in a team approach, meeting caregivers and those individuals that they're caring for along the way. I just want to mention that a lot of the work we're doing is essentially supporting the caregiver, mainly. And what I mean by that is we've all thought about maybe social services or services. We always think of the person that we're caring for, sort of as the person that needs the help, which is what we all do as caregivers. That's why we're doing what we're doing. But we're there in a new way to introduce the concept of, if we keep you strong and supported as a caregiver, if we keep you connected, if we keep you in the know, then that is going to indirectly support the person you're caring for. So in the last, I would say maybe 15, 20 years, resources to caregivers has gone way up. You know, it wasn't a thing when I started my career to support caregivers. We want to age in place. As the aging of America, we want to stay in communities. We want our loved ones to stay connected and close. We are now offering programs like ours that will support that and create community support so that we don't need to look at moving always our person away from us, but we can be supported. So I'm going to share with you how we do that. The next slide talks a little bit about our caregiver coaching and consultation space. So when you come into Family Means through our intake line, or you send us an email off of our website, we have a beautiful website that says, do I need to get more help? Is it time to get help? And then you can answer a couple questions, and then that will help you assess, is this a good time for me to get a personal connection with an agency? So that guides you too. You would connect with one of us on the team that does caregiver coaching and consultation, and we would take it from there, meaning you don't even need to know what you need. You just need to share your story and indicate to us where you may want to get more connected, learn more, build capacity in. And so we spend the time then asking the questions about what might be the best next step, and we create we stay with you along the way. Do you want to take a class? Do you want to get connected to a memory cafe? Those coaches are there for you all along the way, because the journey will unfold, like Carolyn said. No two people have the same journey with caregiving for someone with dementia. So we do that in person, we do that over the phone, and we do that virtually. I do coaching sessions in those 3 ways. And that allows us to serve people all over the Twin Cities. And so don't consider it a barrier if you're not within Washington County. We want you to know that. So this concept then, if you've met with us as a caregiver coach or consultant, then leads to our next slide often, and thank you, Carolyn, for already teeing up what the concept of respite is and different ways that it can be offered. At our program, we do offer 3 different types of respite in the one-on-one in our model. Caregivers do need planned breaks. They need ways to refuel and reconnect and stay able-bodied, and maybe self-care and ways to do that requires a break. So we do in-home volunteer matches with folks 2 to 4 hours a week. We offer a group respite program, several different locations, both in the day out model in Stillwater, which is Fridays, and then a night out model. And then also we have 2 locations for people designed for early stage. We are diagnosing earlier and earlier and learning more about how to support people in those early stages. So in our Stillwater Community Connection and our Forest Lake Community Connection, your person living with either a diagnosed or an undiagnosed, that isn't a requirement, but is living with some type of mild cognitive impairment could participate in either one of those. We're at the Forest Lake Y up there in that community. And then from that point, if we wanted to move on, I will share with you, and many of you, thank you for taking some of the flyers when you entered, and they're all available if you didn't, off the back table today. We have caregiver support groups, and you can see them listed here also. These support groups, many of us may have had connection with a support group over our lifetime. And this, I hear from caregivers all the time, this is something very different because that peer support and experiencing the journey of dementia, it's so unique that there's that benefit of knowing, just being in a room with others, knowing that you have lived experience together and you can explore resources together and you can feel empowered to take the next step, whatever that might be, based on other people's experiences. We at Family Means offer a variety of ways to stay in connection with other caregivers because we see the value. We offer things virtually, we offer them in person. Every week we have something. We don't want a week to go by that there's not an option to support with, to garner that support. And our caregiver support groups are run by a staff member on our team. I will just say that many of our caregivers have attended, to just give you a perspective, for several years. They have been a caregiver, and maybe even their person has moved into memory care. There's still a caregiver, there's still a need to stay in connection with others. So we have a mixed group oftentimes of caregivers, both caring for someone in their home or in a care setting. And that provides that level of support through all the many stages of journeying with dementia. So our next slide talks about some of the things our program does on the daily, weekly, monthly, quarterly, seasonally, all the time. We have an educator, community educator on staff, but each one of us on the staff is involved in the offering of our education. It's often a great way to start with our program because maybe you think, I just want to learn a little bit more. Carolyn mentioned Powerful Tools for Caregivers. That's an evidence-based wellness program. We offer that twice a year. It's offered virtually and in person. Those are wonderful ways to just have more tools in your toolkit. Find ways to feel more empowered and more able as a caregiver. So that's the first one here. Shaping Your Tomorrow is unique to Family Means. It's a 10-week series for both the person caregiving and the person living with either an MCI diagnosis, mild cognitive impairment, or a dementia, early stages, that you attend together and you learn together about some of the different resources in our community. We bring in presenters to talk about, have you planned about, driving retirement? Have you planned about how do you start looking at different senior housing options? There's 10 weeks worth of most valuable information, and because you're going through it together, oftentimes then we ask you to invite in your family members. And how do you continue the conversation back at home to facilitate accessing some of the resources that we're talking about? And lastly on this list of educational opportunities is our Finding Meaning and Hope series. That is a series that we offer twice a year. Again, another 10-week series. Pauline Boss is the founder and developer of this program. She talks about ambiguous loss. It's a concept that's been around for almost 30 years now. Caregivers are experiencing loss on the daily. Loss of relationship, loss of things we used to do together, loss of shared moments in ways that were part of the relationship, loss of who your person was in embracing who they are now and finding hope in who they are and what you are now together. And this wonderful series is offered with Pauline Boss leading it in a virtual format, and then there's a book that goes along with it. So if you're a person that can identify with ambiguous loss and want to start attaching some hope with it, we do that together over 10 weeks. So next I'll share a little bit about our memory cafes, and some folks on the way in were asking about our memory cafes. This is a wonderful concept. It's an international model, right, Carolyn? I mean,
Oh,
yeah.
absolutely.
It's a model. I think it started in England, maybe.
It started in England, and Lori LeBay brought it to the U.S.
Oh, she did.
Yeah.
Wonderful. We at Family Means have 3 memory cafes that happen every month, and the whole goal is to welcome those living with memory loss and whoever you identify as your caregiver. Oftentimes, sometimes it's an adult child that comes with, because it gives maybe a break to mom, and then you can take some time to go out with the person living with impairment and be in company of others who are also in that same space of a cognitive impairment. And you're together, and it's led by a staff person. We are at a library. We are at the Lake Elmo Inn. We're there when it's not open, so they open their restaurant to us. And then the same with the Blue Heron Grill up in Hugo. And those are places and spaces where you are welcome in, to know that you can meet others, again, maybe in some of the same spaces and places, and socialize together in a dementia-friendly setting in the community. So next I would say, again, another thing, the next stage, yes, thank you, our empowering persons living with dementia is unique to Family Means, I think, in that we have an OT on staff. Her name is Heidi, and she leads a lot of our programming. But what's unique about what she does is work with also individuals coming into knowing what it's like to live with dementia, the person that's actually experiencing the changes in their brain and how the disease is impacting them. And she does one-on-one consultations to provide guidance on maybe what some of your next steps could be, your unique path. She's journeying along with many individuals living with the disease. And maybe what do you want to put intention to? What might you want to accomplish when you're still able and living your best life going forward? So she does one-on-one consultations. She does a monthly group called Journey Together, and that's a virtual gathering of those with early stage dementia or cognitive impairment, where you're connecting with others and sharing daily struggles, sharing daily joys, and finding purpose in how you're adjusting life together as an individual living with the impairment. And then lastly, community connection is available for individuals. 4 times a year, we do a 6-week session. If you have mild cognitive impairment or dementia, early stages, we break down the stigmas about dementia in that we come together with others. You do activities together. You go on field trips together. We bring in music. We're always doing things with the McPhail Music Center. Our whole goal is to explore and continue to stay engaged in your community and with others. Can you ask that again?
It's okay.
That's okay. All of our services, good question, thank you for asking. All of our services are offered on a sliding fee contribution based. Suggested contribution, yes. We get, a lot of our funding comes through Trellis, which is the Area Agency on Aging, and some grants. Very accessible to all. Moving on to the last couple slides here. Virtual reality, whether we like it or not, we are living in a time where we have opportunities to gain insights through new experiences, and we have found and invested in what we call it's called VR. It's virtual reality. I have experienced it. We don't know what it feels like to live with dementia unless we're the person living with dementia, and so this opens up a whole new way of learning and understanding what it feels like. There's scenarios that you get to understand with the sensory components, the changes in the vision, hearing, how that all works together, and how your brain may be interpreting data around you, your environment, things like that. That gives you a real lived experience to gain both perspective of the person you might be caring for or a family member, and an opportunity for insights that couldn't exist any other way. You can grow your compassion through. I've seen a lot of family members experience virtual reality, and on a dime, they have a new level of compassion for the person they're caring for. So it can be used in many different ways. And then there's a couple different scenarios, how it feels like to live with macular degeneration, Parkinson's, and some of the effects of social isolation of any of these circumstances. So we really do want to touch point many of the different ways that we can learn together. Our next slide shows us something that we're doing pretty often out in community. We just wanted you to know about it here at St. Odelia's. Our staff often, when we're in community, hear from individuals that they're concerned about a loved one, or, I don't know what to do next. How do I connect them to the doctor? What's my next step? There's many ways, but maybe sometimes when we do a memory screen or ask a few questions in a safe environment or spend a little time with a community provider, that can create a conversation that isn't about a diagnosis or about a life-altering change of a circumstance. So we would, oftentimes when we're at community events, we offer memory screenings. We have gone into many churches and offered this in addition to what else might be offered throughout the community. So I wanted to just let you know that that's also something that we're often seeing in community doing. And then with that screen, it's a 5 or 10 minute screen, we then immediately can connect you to support within our services. And that's oftentimes something you might get in the clinic, you might get an actual score, but then what do you do with that information? How do you start to feel that sense of, I can still navigate this somehow, some way? And so we've heard from many caregivers that this experience of doing a memory screen is much different than what you're maybe doing in a clinic. And this shouldn't supersede that. This actually is oftentimes something that then helps an individual decide, I need to talk to my doctor, and this is the next step. So our last slide is just, I wanted to, as much as that's what our Caregiver and Aging program is all about, Family Means is, if any of you have had any touch points out in Stillwater, they're very well known throughout the whole county. We are a mental health organization offering several ways and means of supporting families. We have a counseling and therapy department. We have an employee assistance program, youth development, financial solutions, those that may be dealing with debt. A lot of us on fixed incomes, we need to figure out how to create ways, and in living with any chronic condition, there can be financial impact. And so we have a wonderful department that works with many of our older adults. And then lastly, in St. Paul, we have a Center for Grief and Loss. So there's 2 homes that we own right on Grand Avenue, and we have therapists and clinicians there that offer support specifically for those walking through grief and loss, which many of our caregivers, ambiguous loss is part of caregiving. There's a lot of grief and loss in caregiving. I know we're going to do questions at the end, so I will turn it back over to Carolyn.
Thank you, Lynn. Is this one turned off? So I'm back on my mic on my chest. I don't want anybody to hear screeching. Okay, so would you go back to the map that I shared with you, because I missed several things. If you have a pen, it's on slide number 25. For Family Means, I did not intend to, so let me also tell you, if you could add to that Cottage Grove on their map. Cottage Grove, Woodbury, Lake Elmo, Hugo, Forest Lake. So let me repeat those again. For slide number 25 for Family Means, if you could also add these cities that they are able to have some services offered. Cottage Grove, Woodbury, Lake Elmo, Hugo, and Forest Lake. I was so happy that Lynn could come today. I'm going to tell you that, your faith community should be very proud of Lynn. She's a graduate of St. Odelia, and her parents go to this faith community, or her dad does now. So I also want you to know that I personally have never felt competitive with other agencies. I feel that you need to use whatever resource is the best fit for you. If it's the closest to your home, it's the easiest. If you can do it virtually, like Lynn said, there's so many services they can offer to you virtually. And I know the staff at Family Means and know them to be very good. So let's go back to now slide 38 for the Faith Community Nurse Network. This is who I happen to work for. And I just wanted, now, like Lynn said, they are offering Powerful Tools classes, so I don't have a problem with where you take your class. It might be that one is at a time of year that you can do the 6 weeks with them. It might be that it works better at the time that Family Means is offering it. I just had them print a flyer for our next Powerful Tools class that we're offering. So I wanted you to hear what Powerful Tools means. It's a small group workshop for 10 to 14 participants. They're an hour-and-a-half session each. There's one session a week, and it goes for 6 weeks. You, as a participant, go through our hearing about a variety of caregiving experiences when you attend together as a group. Every participant receives the Caregiver's Help book. It's always led by 2 trained facilitators. Many social service agencies listed here will offer this also, like Lynn mentioned, for their group. It is an evidence-based education, so this is a tool. There's a group that can work with people working with children, but also with adults. So it can help people who help a parent, spouse, partner, child, or friend who lives with a long-term health condition. And I just finished teaching my first session of this for 6 weeks. And I've been a caregiver for a long time, and there was valuable information in it. I found it really excellent. It offers practical strategies and tools for caregivers to reduce stress, improve self-confidence, manage goals, solve problems, self-advocate, make tough decisions, and locate resources. These classes are highly participatory, where mutual support builds a participant's confidence, improves caregiver health and well-being. So I really wanted you to hear the value in these classes. Now, before I forget, because I meant to mention this when I came back up here, I did neglect to put one resource in your packet, and that is if your person is ever in the hospital and they've been living at home and you haven't had resources, never hesitate to ask to be connected with a social worker from the hospital. The other thing I'm going to tell you is I've had many caregivers call me when I worked for my prior agency. I bet Lynn has as well. When caregivers are in the hospital, you may have never talked to a social worker before, but don't hesitate to call someone like Lynn at Family Means while your person is in the hospital and say, I don't know what to do next. For example, I have tried to empower families to say, you must talk to the medical team and say he cannot come home or she cannot come home because this and this and this and this and this makes it unsafe for them to come at this time. So they can help empower you to know what to advocate for prior to that discharge. You cannot take from a discharge and be readmitted just because they shouldn't have been discharged. That doesn't work that way. So you need to take advantage of it while they're in the hospital. All right, I want to go to the next slide, and Lynn mentioned their whole person wellness screenings as well. So again, we're not in competition with each other. I just want you to know that we have these screenings and we do them across the metro, whereas Lynn's group does them within Washington County. We have our schedule coming up for the summer, mid-June to mid-August on Tuesdays. The fall hasn't been determined yet, or the spring. But our screenings include a whole array of things. And if for some reason your faith community is interested in offering a wellness screening, if you're willing to open it to the outside community to come in as well, we can come in. We do in partnership with the University of Minnesota nursing students. This summer we'll be working, I believe, with the master's preparing nurses. And I'm the dementia specialist for those, so I actually offer the Montreal cognitive assessment if people want that they have not done well on the initial memory assessment. So, and then I give resources from that. So I want you to know of this if you're interested, or if you know of other faith communities that would be interested in, or buildings, apartment buildings, assisted livings that would be interested in hosting wellness screenings. All right, the next one, I just want you to know a little bit about my work so that either you can feel free to say to Deacon Jim or others on the team here that you'd like me to come back and talk on something specific. And I've listed the 8 things that I'm talking about currently, although I have developed other talks such as these to be able to do this. So I do teach a course called the Dementia Friendly Faith Communities, and it now is probably 50% new material. You're going to hear some of those materials next month. I encourage you to come back when we talk about spirituality and dementia next time. I will provide you with a spiritual assessment, meaning there's some really, so my being a faith community nurse for 9 years in a church allowed me the opportunity to, I feel like, and then having worked 20 years with people living with dementia, I feel like I selected questions that could be something that could be helpful for them to answer. If you recall, when I gave you the life story form in one of the past sessions, I have now added a 3rd page to that is just spiritual assessment questions. And the reason we would want to ask those questions is to try to help us as people go through the journey that we're providing the appropriate spiritual help for them. And you're going to understand a lot more of this next month when you hear, but it is exciting information. I think it's critical information, so I just want you to know about that. Next, I also talk about brain health versus dementia, including tips and typical aging. I talk about, as you've heard here, your role as faith, community, faith, family, and friends. And the one that you won't have heard is the navigating delirium, which I just did for Lynn's caregivers out in Stillwater. For any of you that have had someone, it could be, I mean, I'm of the age that I could experience delirium if I was put in the hospital and had a surgery or had an intense amount of pain. I could go into a delirium myself. So it's trying to help people understand what does delirium mean. And for those that are living with dementia and have experienced delirium, it can be very frightening for family. Okay, let's move on to the next agency, and that is Wilder Foundation out of St. Paul. Now, they no longer offer their group respite program that they used to, but as you can see, there's still several things that they offer for caregivers, including adult children caregiver support. And if you go to the map on the next page, you will see that they are located in St. Paul off of Lexington, so you will be able to know that resource. All right. Somehow, Anoka County got dropped from the pages, and I'm not sure what happened. Oh, no, here it is. Thank you. If you will see, Anoka County, north of you here, has several opportunities for caregivers, including their out-of-home group respites, also called The Gathering. They were able to replicate what Lingblomston's Gathering does and run similar, although it's been several years now that they've been doing their own programming, so they may look different now. Coon Rapids, Columbia Heights, and Anoka are where those programs are located. And if you look at the map on the next page, I put the stars on the map of where those cities are located. So you can see if you live up in that corner of Ramsey County, some of those options might be better. The next agency is Ling Bloomston, and I want you to know that they do specialize in serving those with memory loss. I would say that Family Means also does. And their gathering group respite is 3 days a week at 2 locations, at Como Park campus and Lino Lakes campus. And they do offer caregiver support, consultation, education, and resources and support groups. What I also want you to see is that their Lino Lakes assisted living also does temporary respite when I was talking about facility respite. So if you go to the next page, the next slide, you'll see between the Como campus star in Ramsey County and the star up in Anoka County where Lino Lakes is, if either of those might be a handy option for you or for someone that you know. The next agency I want you to know about now, we're headed west, is Normandale Center for Healing and Wholeness in Edina. And again, they do a lot, including having visiting volunteers and respite. They do a medical equipment loan program, community workshops such as Powerful Tools. They have a memory cafe, caregiver support and education, and care consultations. If you go to the slide, you can see where they're located. And they are kind of on that south end of Hennepin County. All right, number 10 will take us to Senior Community Services, who offers caregiver coaching, support groups, information and assistance. What that means is you might not have ever called, but you can call and say, hey, this is happening. I don't know who I should be calling for this. And it could be a matter of a 5-minute call. So that's what information and assistance means. It could be a longer call, but that's how that information and assistance works. They can do caregiver consultation, family meeting facilitation, memory cafes, and they are in the 7 western metro counties. So if you look on the next slide, there wasn't really a good way to put stars on here, but can you see where all these arrows are? That now we're going out and you have access not only to Ramsey and Anoka and Hennepin, but you're also in Wright and Carver and Scott and Sherburne. So if you know people in those areas, get them in contact with Senior Community Services. Lynn, does Family Means do family meetings? Okay. Do any of you wonder what I'm talking about when I say a family meeting? Is anybody curious what that means? A family meeting is when there might be difficulty coming to a decision or wanting to collectively come together to figure out things, but you're kind of needing someone to facilitate the conversation. It might also include where there's been past hurtful relationships in a family, to have this mediator, facilitator involved. I highly encourage you, if that sounds like something that could be of help, that you pursue it further. And for example, contact Lynn to ask more about it. But that particular agency was Senior Community Services, and more on the west side, but also Ramsey County. Then we'll go to DARTS. Now, I'm going to just tell you that I cheated a little bit, because I don't know that they go by Dakota Area Resources, Transportation, and Services anymore, but that's how I knew them. And I thought it would be helpful if I broke the name down so you could see that they're pretty big. They used to have a bus that drove all over. I don't know how much their buses are in service like they used to. But know that they do caregiver counseling and coaching and family meetings. They have individual respite, but they also run the group respite called the Breathing Space, and that's a replication of Ling Bloomston's The Gathering. Those are in Apple Valley, West St. Paul, and Eagan. And they also have caregiving support groups. So if you go to the map, you can see these are kind of in that north end of Dakota County, but available for people to get through that way. Now, if you go to the next, the Caron Organization of Minnesota. So this is individual and family services for refugee and immigrant communities. So I provide this because there may be somebody that will listen to this series that this will be helpful. But what if you have a neighbor or a friend that you think also might be able to use this resource? So I wanted to make sure you knew of them. They are a home and community-based services program. And since they are of Minnesota, although they didn't call me back with an answer to my questions that I left for them, because it's of Minnesota, they are going to provide help across the state. What I found fascinating about them is they have staff that speak, now, I'm going to ask forgiveness or grace because I'm not sure I'll pronounce all these correct, but Amharic, Burmese, Dari, English, Karen, Oromo, Pashto, Spanish, and Urdu. Did I do a terrible job pronouncing those? Pretty close? Forgive me if I did. But I wanted you to know about them because I live in a community in Maplewood that is very highly populated with Hmong immigrants. So I think it's good for us to know of these resources. The 13th organization I want to share with you is called East Side Neighborhood Services. It's on 2nd Street Northeast in Minneapolis. And at the moment, they run their group respite Northeast Day Spot on Fridays, and they have caregiver support. So if you go to the next slide, you'll see where they are located. So that is right tucked up alongside Ramsey County, and a nice facility. Have any of you heard of the block nurse programs? Living at home block nurse programs. So this is a statewide network that helps older adults maintain a safe and healthy life at home. And so even though there's several different locations, know that each living at home network might offer different services and programs. So if you go to the next slide, I want you to see the metro programs. So if you look at the colors, I'll tell you what they represent, okay? In that bright green is the Como Park Falcon Heights Living at Home Network. In red is the East Side Elders. Then in, and that would be that pinkish red, or I don't know, orangish red. Then there's the blue, which is Hamlin Midway. The orange then, do you see that down towards the bottom, the south end, is Keystone Community Services. That maroon over towards underneath the word Minneapolis is the Neighborhood Network for Seniors. That dark blue down southwest Minneapolis is Nokomis Healthy Seniors. Then there's a purplish pink color, kind of below the word, well, shoot. Yes, is that where it says McAllister? That would be the Longfellow Seward Healthy Seniors. Then there's a purple that is the North End South Como Block Nurse Program. The pink is the St. Anthony Park Area Seniors, which I've worked with the most. They were on the Roseville Alzheimer and Dementia Action Team with us. In the yellow is the Southeast Seniors. In the black is the Northeast Seniors. So do you see how if you didn't know about the Block Nurse Program, they're actually in quite a few areas around the metro. If you go to the next slide, what I wanted you to see was outstate. Look at all of these little pins on the map of where the living at home networks are in case you have family that's living out in these areas.
I think Stephen should be St. Stephen.
Say that again?
I believe Stephen should be St. Stephen.
Ah, so I missed a saint on that. So add saint to Stephen. That would be in the second column, third up from the bottom. Please make that a St. Stephen. Thank you for catching that. So there's Argyle, Atwater, Barnesville, Foley, Two Harbors, Granite Falls, Grove City, Owatonna, Holdingford, Park Rapids, Middle River, Frazee, Silver Bay, Paynesville, Pelican Rapids, Pine Island, Queermunity in Minneapolis, Rothsay, St. Stephen, Viking, Holt, Newfolden, Warren, Alvarado, Oslo. Isn't that amazing? Because I'm actually reminding myself that some of these agencies actually have a far outreach. The next one I want to tell you about is Lutheran Social Services. And if you see all the things that they offer, I want to point out their in-home and group respites are in East Grand Forks, Spicer, Moorhead, and Hutchinson. They also work with services for veterans, waiver services, emergency care planning, caregiver supports, coaching and counseling, care coordination. And if you go to the next slide, oh, I didn't provide a slide. I'm sorry. I provided it in red so you could see the communities that they were in. All right, the next association is the Alzheimer's Association, and they can give individualized solution-focused support and an in-depth service for individuals and families. If you go to the next slide, you'll see their 24/7 helpline. And again, to remind you, for all forms of dementia. And then I also want you to know that you can reach out to this helpline at any time of day, every day of the year, all night long, and for many different reasons. So don't hesitate to call. They are not 911. Don't call them if it's a really emergency. But if you're having trouble, not sure how to manage a situation, you have time to process it with somebody, that is a possible number. The next one, number 17, is the Roseville Alzheimer and Dementia Community Action Team. Tom Hayes and I have been involved. Tom is still currently going with them. That's been around since 2013. And I just want you to know that these lists on here are updated monthly. So that can give you a list of support groups and services, dementia-friendly activities, as well as past presentations. All right, we're doing great, staying on time here. The Twin Cities Support Group for people living with Lewy body dementia is the next one. I want to make sure you know of this. Tom and I know Paula Beaver, and she had a parent living with Lewy body dementia, was very active and knows the staff at Mayo Clinic, and has been named in 2017 the Lewy Body Association Volunteer of the Year. If you look at number 19, that is also her group, and that is for dementia caregivers that have someone living with Lewy body dementia. If you recall from my talks before, Lewy body dementia is very different than dealing with other dementias. Okay, number 20. If you see that this is a workshop, this is time sensitive, on April 29th, at the Roseville branch of the Ramsey County Library, there's going to be occupational therapists Megan Hunter and Sue Redepenning, and they're going to have many assistive technology devices for you to look at and experiment with. Two of them, for example, are the Theora Watch and the Angel Sense trackers, but they'll also have items such as the Find My app to locate people and some communication boards used by individuals living with aphasia. I don't know if you know what aphasia means, but that is when they have trouble finding their words. And some people get to where all they can say is yes or no. What I also want to say about aphasia, as a side note, is I think the opportunity to get them involved in a social program such as a group respite or in-home respite as soon as possible is best. When these volunteers learn the people living with aphasia, they can often know an idea of what they're wanting quicker because they've gotten to know the person. We have had individuals, I ran an online group during the COVID shutdown, and one of the 5 groups was a group of people with aphasia, and we had a blast on that hour program. We laughed like crazy because we'd known those individuals and built up rapport with them, and were able to have a good time. So I think for you to know about this workshop is important. The 21st resource for you is an annual conference that Joe Gogler does at the University of Minnesota. You can either attend it in person or online via Zoom. I've given you the link to see about this. It, as I said, is offered annually, and it's from the School of Public Health. We used to have give me 1 second, I've lost the words. It was an Alzheimer's conference, and I can't remember what it was called. It was at the Excel Energy Center, and Mayo Clinic did it together with them, and it was excellent. I never missed a year. And then it just stopped because they put their emphasis more on the research end of things. And so this is the conference to go to. I know Mayo offers a conference or two as well, but this one is one I would recommend if you're looking for education and support. And it's free. This one's free, whereas the Alzheimer's conference you had to pay for. And sometimes if you have to leave, it's easier to leave when it's free than when you've had already invested several dollars. All right, and in 22, I want you to know about this resource. It's for disability caregiving, and I've given you the contact information for that one. The next one is online educations. And what the Health Partners Center for Memory and Aging, Lifelong Learning has a link there to get to their online educations, as well as the Alzheimer's Association Education Center. I also will put a plug in for Health Partners that in the past I've given you a workbook that people with early memory loss in that early stage can work on, and that's been good. Also, I will say that through the Health Partners Center for Memory Loss, Dr. Terry Barkley's wife, Michelle, has done some mindfulness work with caregivers in case that's of interest, so to contact the Health Partners Center. I would be remiss if I didn't include your 24th resource, and that is the resource here every other month for the memory care masses. Please spread the word on this. Do you know that as many as 30 people have attended these? And I want you to share it. I want to tell a story. I know that Deacon Jim and Tom have heard this and Becky from me before, but I met a 4-generation family that they brought, so there was a baby, a young mother, her aunt, and her grandmother. The grandmother had not been to a faith service in 23 or 24 years because of the type of brain injury dementia that she had. And they were like giddy and like in tears over watching her go through this beautiful faith experience, because what you're going to hear from me next month in more detail, please encourage people to come, is that this is an often missed opportunity for people living with dementia. We forget that spirituality is important to them. It's one of their needs. It's like air and housing and or shelter, right? And food. Spirituality is a part of what's important. So I want you to look at thinking of coming to that, which leads me to giving you the date for the next one. Make sure you tell people to come in the evening. If they come in the afternoon, they might have some quiet time. But we'll be at 6:30 in the evening, and that will be the last of the 6 that we will be giving. If you go to the next slide, that's the link for these, and the next slide is where I want Lynn to come up. I realize now, Deacon Jim, do we have to be out of here by a certain time? 2:30? Okay, so what I want you to know is that at that time, maybe Deacon Jim will stop us, and we'll go up there for anybody that wants to talk with Lynn and I further. But is that microphone on? And go ahead and ask questions. Yes?
Will you, on slide 56, allotments programs, there was a bunch of places, but nothing for like Roseville and Shoreview and is there not a program?
So there's the Midway program, And there's the Como North End, and there's the Como Block Nurse Program. The Como Block Nurse Program is at Como Lutheran Church on Midway Parkway. Did I miss that one? I might have. I don't know why I would have missed it, because I took things off their site, but that's a good question. Thank you for asking. Any other questions? Did you all hear what she was asking about? That was for slide 56 on the Living at Home Block Nurse Program. She wondered if there wasn't another one in St. Paul. Anyone else? Can that mic be turned on for Lynn? Any other questions?
So I just wanted to highlight the question that was just asked because as Carolyn and I were talking, as much as we want to share with you where everything is located, I wouldn't not connect with an organization based on where they're housed, except for the Black Nurse Program, and that's what made me think to tell you that, because they're specifically only going to serve, that's their whole scope, is the neighborhoods. That's how they're funded. The rest, many of our other organizations have funding and were housed in these areas that the stars were, but our service area, which is very different, may be like we serve the entire Twin Cities. A lot of our on-site programming is Washington County, but if you call me and you want to do coaching virtually and or come to me, we would still serve you because that's how we're funded to serve the Twin Cities. So if one of these organizations has something that you would like to learn more about or get connected to, don't rule yourself out based on where you live. That's maybe a better approach to take. And all of us know about each other as providers. So if you call one of us and we're not the right place, we're going to get you to where you need to go based on what we talk about together. So you don't even need to be the expert on who to call.
Right.
Does that sort of support all of the, I think what the amazing thing that I can garner from all of that you've provided us, Carolyn, is that there's a lot of support and resources available. We are all, I say this often, we are hidden under a bushel.
Too much.
We are here, we are growing, we want to support you and connect you, but we're busy doing the work. So oftentimes you won't see us at big marketing places, or we don't have the shiny maybe building or such. We're right there with you, serving in different community locations. So oftentimes we don't have like I'm up at Forest Lake, but we don't have a sign saying, the Y is also where you go to get some family means support. So that would be true for all of these community providers. We are nestled within your communities.
Right.
And we want that for our people and for ourselves. We don't want to be going to big, huge locations where we might feel not in connection with others.
Thank you for that clarification, very important. I put it on the map partly so that in case you were looking for in-person programming, you could find one near. Okay, thank you, Michael, yes.
I just want to point out that our next memory care mass, which you highlighted, is a week from tomorrow.
Okay.
Next week, Thursday.
Yes.
And we hold the mass in the chapel directly behind this sanctuary.
So today is Wednesday, it's a week from tomorrow.
Correct.
In the chapel, and it's at
1:30.
1:30. So spread the news about the memory mass.